Welcome to Physician Focus. I'm Dr. Bruce Carlin. If you're experiencing difficulty hearing, you're not alone. Hearing loss is one of the most common chronic conditions of Americans of all ages. According to the National Institutes of Deafness, more than 30 million Americans aged 12 and older have some level of impaired hearing. Among older Americans, hearing impairment is the third most chronic condition and can lead to social isolation, functional decline, and depression. This edition of Physician Focus will examine how we hear, the signs, symptoms, and causes of hearing loss, what we can do to prevent hearing loss, and what remedies are available for those who do experience such a loss. With me for this discussion are two board-certified otolaryngologists, physicians who specialize in disorders and conditions of the ear, nose, and throat, and related areas of the head and neck. Dr. Jeffrey Brown is a physician with ENT consultants at Winchester Hospital and is the current president of the Massachusetts Society of Otolaryngology, the statewide specialty group for ear, nose, and throat physicians. He's a fellow of the American College of Surgeons and a clinical instructor at Harvard Medical School. Dr. Theodore Mason is a physician with ear, nose, and throat surgeons of Western New England and Springfield, Massachusetts. He established the Cochlear implant program at Bay State Medical Center in 2003 and remains its director. He is also the president-elect of the Massachusetts Society of Otolaryngology. Welcome to you both.
Thanks for having us, Bruce.
Thank you.
Nice to start talking about hearing loss. Why don't we start? Ted, can you march us through what normal hearing requires? You've got a nice diagram there.
Yeah, so we have a diagram of our hearing system here. I think we all recognize the external ear, and that goes down the ear canal to the eardrum. Behind the eardrum, there's three little bones in there that, remember the hammer, anvil, and stirrup? Well, those connect the eardrum down to the hearing organ. Looks kind of like a snail in there. Inside the hearing organ there are these little nerve endings in here called hair cells. So the way our hearing works is that sound travels down the ear canal and strikes the eardrum. The eardrum vibrates back and forth, and those vibrations are first transferred mechanically through these little bones into the inner ear. Now when those vibrations go down and they strike the little nerve endings, those hair cells in there, they send an electrical impulse to the brain. So there's parts of the hearing that are mechanical and parts that are kind of electrical. So those two together give us our hearing.
Pretty interesting. So when this gets impaired, how frequently does that happen? Jeff, you have some figures on that, or?
Well, unfortunately, the hearing starts to deteriorate naturally at about age 30. So as we mature, the hearing starts to deteriorate without the influence of external factors, diseases, loud noise. So obviously in the senior population, we see people commonly with hearing loss. Not as prevalent in adults, although I think we're going to talk later about some of the risk factors for hearing loss in adults. And we're seeing an upswing in young people hearing loss. And again, the concern is loud noise exposure damaging their hearing.
So what percent of seniors over 65 would you estimate have some hearing loss? Now, part of that you're saying is just normal attrition of your nerves. Is there some cutoff that you use that says, okay, now you've become officially hearing impaired?
When we look at the hearing test, we have a pretty good idea of how much hearing loss they have, but we also have to blend in how much trouble they're hearing day to day. And so it's not a magic number. But we expect that as senior citizens come in and get their hearing tested, they're going to have some amount of hearing loss. And again, there are other factors that come into play, whether they've had ear infections, ear damage, loud noise exposure, genetic factors that may force their hearing down more. But the issue of at what point are they disabled really is more how much trouble they're having with their hearing their family, day-to-day function, hearing the television and on the telephone.
So, you know, obviously, my wife complains that I'm never listening to her, but that's a
common malady.
That's a different problem. So, you're taking all these things into account when you examine a patient. You're saying you're making a functional assessment of how bad this level of hearing is to your functionality.
But that's also a personal assessment. I see people who have what we would term a relatively mild hearing loss, and they're very significantly affected by that. So people who use their hearing on a day-to-day basis, college professors, physicians, people who are working with people on a day-to-day basis might be significantly hindered by even a mild amount of hearing loss on an audiogram. And then you have other people who have a rather significant degree of hearing loss, and they're kind of hearing everything they want to hear, and they recognize they're not doing great in all these environments, but doesn't bother them. So there's really a personal assessment of hearing loss that is very individualized.
But you've got some levels that you deal with on a day-to-day basis.
I do see some people who say, oh, my hearing is fine, and I look at their hearing test and I go, really, is it fine? And usually their wives are there going, no, it's not fine. So I often talk to family members to give us a real assessment of how a person's hearing might be functionally.
So what are the causes of hearing loss? You've touched on a few, and maybe you can explain what gives us hearing loss.
So I'll start out, and if you want to chime in. So common things we see besides aging would be loud noise exposure. And this could be, most commonly we see it in adults who have work exposure. It could be from loud noise exposure from loud music. And this is the concern we have with young people listening to headsets and turning the music up too loud. From infection, ear infections can cause hearing loss, ear injury, head injury, ear surgery. Those are, I think, the common things that we see.
We also see genetically mediated factors. For instance, I see a lot of children who are born deaf, and oftentimes that's a genetically mediated phenomenon. And so sometimes they're born deaf or with a rather significant degree of hearing loss, or sometimes we see children who were born hearing and then develop hearing loss as they get older. A lot of these are genetic factors that we're really just scratching the surface of how to diagnose. There are also other genetic phenomena that cause earlier onset adult progressive hearing loss. Some of them are surgically reversible, some of them use amplification, which we'll talk about in a bit, I think.
One of the scary things is I occasionally get patients with some sort of autoimmune hearing loss, and it happens suddenly, and we're sending them to you guys. And
that is, it's still a phenomenon. It's called sudden sensory neural hearing loss. It's a phenomenon that we really still don't know a lot about why it happens, but we have some good treatments that we've developed over time on how to treat it. So really, a message we give to our colleagues in primary care is if you have someone who comes to you with a sudden change in their hearing, don't delay. Get them to our office right away, because the sooner you treat, the better the potential outcome.
So how do I know that I'm turning my earbuds up too loud?
Well, interestingly, the MP3 players, the electronic music devices, are not set to cut off at a safe level. So if you turn them up loud, it can cause damage.
Can be unsafe.
And if you've had the experience of walking into an elevator and hearing somebody with the earbuds in, and everyone in the elevator can hear the music, that's obviously too loud.
Or if you can hear the next car.
Right.
Same idea.
Yeah, same idea. And so there are ways to filter the sound on an MP3 player, on an electronic music device, to keep it from getting to the point where it would damage hearing. And that can be a filter that's inserted onto the earbuds or the headset, or it can be programmed into the electronic device.
So do you recommend this? Maybe this is something we should be recommending in all primary care offices. It sounds...
Absolutely. You know, I think we're seeing more and more people that are using personal listening devices, and the real danger here is when it's turned up too loud, it can cause permanent hearing loss.
The body's pretty good at knowing when something is too loud. There's a certain decibel level of sound that actually becomes painful, and if it hurts when you hear it, you know that that's way too loud, and even brief exposures to painfully loud sound can cause permanent damage. Boy, I remember going to rock concerts when I was a kid and just cringing with pain from the loudspeakers.
How quickly did you leave?
Well, I stuffed what I could in my ears to remedy that, but I'm sure I lost a little bit of hearing from some of those experiences. And kids today, we're proving it earlier and earlier. We're seeing kids with noise-induced damage to their hearing system as young as 16 and 17 years of age. It's pretty impressive.
So, do we have a typical scale that you say, all right, here are the sort of the level of things that you want to avoid? And I know you brought some stuff here about
so
decibel levels.
There is a decibel level scale, and 0 would be the softest sound that the human ear could hear. And going up from there, things like a chainsaw would be at 3 feet would be around 100 decibels. A jet engine would be about 140 decibels. And as you can imagine, as the sound gets louder, the human ear can tolerate it for less and less time. So we have a scale that OSHA puts out that shows us how long you can be exposed to that certain volume of sound before there's damage. And as it gets louder, it goes from hours to minutes. And when you get up to the level of a jet engine, just a quick blast or a gun blast without ear protection, a quick blast can be enough to cause permanent damage.
That is, so I just remember I took my son some years ago to a rock concert and ended up standing in front of the speakers, which was about one of the most painful experiences of my life. Yeah. He loved it, of course, but how do we roll that back? What are the things that you do from the office to help patients out with that?
Well, I think the key is prevention, and so what we talk about frequently is hearing protection. If you know you're going to the rock concert or you're going to be mowing the lawn or using a leaf blower, use hearing protection. It doesn't need to be fancy, it doesn't need to be expensive. The over-the-ear earmuffs that you can get in a hardware store, the in-the-ear foam plugs that go into the ear. People ask me, what's the best hearing protection? I say, it's the one you actually use, okay? If it's sitting on the shelf, it's not doing your ears any good to protect. So for mowing lawns, using leaf blowers, certainly hearing protection is simple to come by, and it'll get your noise exposure down to a level that's not going to cause you permanent damage.
Any other thoughts in terms of, do you talk to kids about this? Are you able to convince them, protect your ears if you want to play in a rock band?
Yeah, when we see teens in the office, we frequently will talk to them about their noise exposure, and I see the moms and dads in the background nodding their heads when we warn them they need to keep the volume down. It's very prevalent for kids to listen to music on personal devices, and I think it's quite common for them to turn the volume up.
Do you say things like, if your parents can hear it, it must be too loud?
Well, what I usually tell them is if you protect your ears now, you probably won't need to use hearing aids very soon, and if you keep blasting your ears with loud noise, you're going to be wearing hearing aids very soon.
That is a bit of a motivation for a lot of kids. Actually, there's some electronic devices have volume limiters on them that the parents can get into the settings, limit the volume output to a certain level, and lock it down with a password. So iPods, for instance, can do that. And so for parents who are chronically catching their kids listening to music that's clearly way too loud, they can do a little something about it. And also, there's electronic things that you can put in line with the headphones that would limit it as well. So there are steps parents can take to kind of save the kids' hearing for their own good.
Is anybody, I know both of you work within organized medicine, so is there any push from the organized groups to talk to the manufacturers to limit the noise exposure?
Not that I know of.
I don't think that's gone anywhere, but there have been some national organizations that were combined with the audiology associations and the physicians associations that have gone out and done big programs to try to educate young people about the dangers of listening to music too loud. So there are some efforts out there.
Well, tonight is sort of unique because you guys have more toys than most of our practitioners, and so when you have hearing loss, that is often permanent because you've fried one of those hair cells or whatever the technical term for that is. But what remedies do we have for people who have hearing loss?
Well, the most hearing loss is what we call sensory neural hearing loss. So that's where the nerve endings, you were talking about the hair cells in the inner ear. There a relatively small percentage of people have a surgically correctable hearing loss where I can do an operation that will repair the little ear bones or something. But really, by and large, most people who come in have a non-surgically reversible hearing loss. That's the sensory neural hearing loss. Now, like I said before,
so sensory neural, basically the nerve hearing loss.
Exactly, and that's what most people have. You know, aging related, whatever. Noise-induced hearing loss is sensory neural. So I tell people about hearing aids, and people look, they go, hearing aids, oh, they say everybody knows that hearing aids are terrible, but not so anymore. Really, there's been some major changes in this over the past 10 years, which have really changed hearing aids, not only in look but in how they work. So I have some examples here. This is this is a hearing aid that people may recognize kind of more as an old school hearing aid. It's kind of bulky. It's not particularly attractive. It's something that most people look at and go, oh, I don't want that.
I was going to say that even that is a step up from the hearing aids that I remember. Right. You know, the big corner. No,
right. Exactly. So that's what I refer to as Aunt Edna's old hearing aids, right? Yeah. So these are certainly better than they used to be, but not as good as what we're seeing today, where we're seeing hearing aids really become much smaller, much sleeker, much nicer design, and a lot less noticeable, because people are still concerned about how a hearing aid looks, sometimes even more than how it sounds. And in some people, the hearing aids can become actually almost invisible to go into the ear canal.
That goes in the canal.
Exactly. It goes into the ear canal, and it's not even noticeable to someone standing right next to you. So depending on the type of hearing loss you have, there are different levels of technology, different levels of amplification, and really speaking with your otolaryngologist or your audiologist to really go over those options. Really, you realize it's so much better than it ever used to be.
I was going to say that the other interesting thing about the designs, the old hearing aids were totally occlusive. You blocked the whole canal, and these.
That's an excellent point, and that's one of the things that's really made hearing aids much more pleasing to the ear these days. The tip of these are what's called open fit, and a very high percentage of people who need hearing aids can use this type of technology. It keeps the ear canal open, and these old types of hearing aids, they give people this what's called the occlusion effect, and what I like to say is my head's in a trash can sort of effect, whereas when you have the open fit style of device, it keeps your ears open and it prevents all those things that make it so uncomfortable to wear.
Well, also the bass tones get transmitted directly as opposed, and you usually don't lose.
It allows natural sound in.
Yeah, you get some natural sound.
Exactly, and it makes such a difference.
And we determine stuff from the bass tones. That's the fundamentals that we're listening for.
Right.
So these are.
Now, and also, people would complain about, well, I hear everything in a room. It doesn't amplify what I want to hear. But really, what we're finding is now these are filled with microprocessors that are taking the sound and cutting out background noise, really focusing in on voice-type sounds, using noise-canceling microphones pointed backwards. So the technology really has come a long way. People are still very focused on what they heard about hearing aids and how much they know they're going to hate it. But when they get it, they go, oh, I should have gotten this years ago.
Well, the old complaints that we get is that it just amplifies the noise. Right. And you're saying that the new devices are actually have some degree of filtration.
They're way smarter.
Yeah.
Yeah, think about how our phones have changed over the past 10 years. Hearing aid technology has gone through the same kind of renaissance in technology to make it a much more useful, much more pleasing device to use. The key is to find someone who does it well. And obviously, as otolaryngologists, we recommend speaking with your otolaryngologist and getting a recommendation for someone in your area who you can...
an audiologist.
An audiologist, really, and that's who we recommend.
Most of you ENT guys have an audiologist in your office.
Right, and we oftentimes give recommendations for where to go and who to see for amplification. Yeah.
All right, so let's go one step beyond this, because you do have some other skills that
Yes.
we'd like to deal with, Ted. What about the person that's really fried everything and can barely hear you when you're walking in the room?
Right.
What do you have?
So we do get to the point where in some people whose hearing loss is so severe, it's deteriorated so much that even conventional amplification, as good as it is, there's not enough power, there's not enough nerve wherewithal to use a conventional hearing aid. And that's where cochlear implants come in. A cochlear implant is an electronically implanted device that's placed actually into that inner ear, into the snail of the inner ear there, to stimulate the auditory nerves directly. It bypasses those hair cells we were talking about. It uses an internal device, and this is implanted surgically. This device takes about 45 minutes or an hour to place. It's an outpatient procedure. And then after it's healed in, after anywhere from a week to 3 weeks, depending on the patient, they get an external device. Now this is a little different from what we've been showing, but what this does is this picks up the sound and it transmits the information wirelessly across the skin to communicate with the internal device to provide the information and stimulate the inner ear. So this is for people who have really what's called severe to profound hearing loss. So this isn't for people walking around saying, you know, I'm a little annoyed by my hearing loss. This is people with really serious hearing loss. But it works amazing. This technology has been developed over the past 25 years and is really, for people with severe sensory neural hearing loss, is really an amazing boon. So
I would just tell you from my personal experience, patients that I've sent for cochlear implants, it has changed their lives from socially isolated, because nobody wants to be around the person that you have to keep repeating
so
everything to, and get right in their face and gesticulate wildly to make yourself understood, to a point where they are totally independent again.
Yes. Well, I can't tell you, you know, the cochlear implants can be placed in children, babies down to 1 year of age. We do it in children, adolescents, adults, but the biggest population who are implant candidates, who don't even realize they're implant candidates, are older folks or the elderly. I've implanted hundreds of elderly folks who went from social isolation, frustration, really, and depression, really, because of that, their hearing loss, to then back in the center of their families again, and really able to you know, enjoy their families, their children, their grandchildren, their great-grandchildren, and really get back into the center of the family. So it's amazingly well tolerated. We've done them up to 91 years of age. So a really amazing technology, really, and the biggest thing I've heard from people is, I didn't even know I was a candidate. I didn't even know I could have that done. So I think any of the viewers...
Most plans will
and all the
it.
insurance companies will cover it. And I just think if there's any viewers out there who say, well, boy, my grandmother really doesn't hear very well, and maybe this is for her, then she should seek out the guidance of an
But even short of that, I think you'd agree that just a better focus on some of these newer hearing aids would be sufficient for a lot of those folks.
Right, so we always start with correcting the hearing with a hearing aid.
Right.
And this technology is really for someone who's failed a hearing aid, where their hearing is so bad that it's not amenable to correction with a hearing aid.
I would say that among the geriatricians, the things that they talk about is that one of the major causes of pseudo-dementia is sensory isolation from either poor hearing or poor sight, and that this goes a huge way in correcting a lot of your, quote, demented older folks.
And there are really some recent studies that really have proven that, that we see that the deterioration of mental capacity goes hand in hand with hearing loss, and reversing the hearing loss starts to limit the deterioration of mental capacity. So that's an excellent point.
We don't have much time left, and I would like you to leave us with some final thoughts. Jeff, do you want to give us important clues from ENT?
Sure, Bruce. So I would say the most important thing that I'd like to emphasize is prevention of hearing loss. And for people that are exposed to loud noise at work or at play, using power tools, again, we talked about younger people who are turning up their personal music too loud, to really protect their ears to try to prevent the hearing loss in the first place. For people that are exposed to loud noise on a regular basis or really can't use protection for a variety of reasons, getting screened by an audiologist, having a thorough, comprehensive hearing test on a regular basis is important to monitor their hearing.
Ken, you got some final thoughts as well?
Well, for me, it's all about the intervention. You know, I think people need to recognize that hearing aids, that amplification devices are really so much more than they used to be, and that people find that they're becoming frustrated by their hearing loss, but really are still stuck in that 10 years ago attitude that hearing aids don't work very well. They need to think again and really seek out the help of an audiologist to learn more about amplification options or potentially cochlear implantation.
Well, Ted Mason, Jeff Brown, the two of you have been marvelous guests. For more information on hearing loss and how to safeguard your sense of hearing, visit our website at physicianfocus.org. I'm Dr. Bruce Carlin. Thank you for watching.
I'm Dr. Jeffrey Brown.
And I'm Dr. Theodore Mason.
More than 30 million Americans suffer from hearing loss, including a third of adults over 60. Hearing loss is the third most common chronic condition among older Americans.
While the primary cause of hearing loss is age-related, millions of children and young adults have also suffered from hearing loss from exposure to excessively loud noises.
This noise-induced hearing loss can result from a one-time exposure to a very loud sound or from listening to loud sounds over an extended period of time.
The noise gradually destroys the nerve endings in the inner ear, and the damage is permanent. This loss cannot be reversed.
To prevent hearing loss, then, it is critically important to identify sources of loud sounds, reduce your exposure, and use protective hearing devices.
For more information on preventing hearing loss, visit the Patient Health section of the American Society of Otolaryngology.
I'm Dr. Elizabeth Goodman. Raising a happy, healthy child is every parent's priority. When your child has a fever or is injured, it's easy for parents to seek medical attention. It's not so easy when kids don't want to do homework or engage at school, are withdrawn or cranky, and tough to connect with, all of which could be normal or could be signs of mental illness. Mental health problems such as ADHD, depression, and anxiety are common among children and youth. In children, these problems often look different than they do in adults. So it's important that parents be aware of warning signs that can indicate mental health problems. Look for relationship problems with peers or family members, trouble fulfilling responsibilities like homework and daily chores, a drop in school performance, or mood changes that last for weeks. If you observe any of these signs, talk with your child's pediatrician. For more information, visit the American Academy of Pediatrics at healthychildren.org.